Hi, my name is Gay Hull. I am a women's health nurse practitioner and an OBGYN RDMS. I've been doing ultrasound for some time, and one of the things in the class that we do when we finish up our second day, when the students start to leave, I always want to express to them the need to keep practicing, to go back to your practice and try to scan as much as possible. It takes time to develop the techniques we've talked about, the skills we've talked about, with just more practice with your patients or with other patients that you can scan and repeat a lot of the things that we discussed over the last 2 days. And the other part is we always advise our patients to please call us, Zoom, call, text, anything, with any questions or any need for additional information that maybe they didn't get or they feel like they wanted to hear back from us. We also usually send out information to them by email. We can correspond also through the website. There'll be additional programs that we're going to be having on our website to continue, but we're available, forever. And that's important, I think, to have that service to them.
Hello, my name is Michelle Zahn. I'm a registered diagnostic medical sonographer specializing in maternal fetal medicine. The most important nugget of information I'd like to give to you is that you have got this, that anybody can do it. We all have a different range of getting our tools and becoming an expert, but ultrasound just takes practice, as you well know, and the more that you do it, the better you're going to become with your craft. Don't be afraid. Count on your colleagues, look at as much information as you can from the reputable sources. There's lots of references here online and within our group that you have access to. And I just want you to know that the more you scan, the better you're going to get, just like anything else. But if you ever have any questions, it's okay to say, I'm not sure, and ask who can help and get the right information.
I'm Kristen Ostrom-Nimcevich, DNP, CNM, FNP, and I've been asked what is the one thing I want students to take away from the hands-on events. What I would like for them to take away is that any information that they're able to get with the ultrasound, whether it's perfect or not, will likely help them care for their clients. Let's say it's 2 in the morning. Or it's 5 o'clock in the evening, you're in clinic or you're in the hospital, and you're not sure of something. Your hands, your usual assessment techniques don't give you the information that you need. If you have a tool like ultrasound that you can add information to the information that you already have, it can make the difference for your clients. It may mean that they don't have to travel or they don't have to have a C-section if you discover that what you thought was a cephalic or vertex presentation is truly that, or if you find out that, nope, you were right, that's a breech presentation and now you can facilitate care. If you're not sure about an IUD placement, it's 5 o'clock at night, you're done with clinic, and you're able to get that extra information so that you may be able to reassure your client they don't have to wait a few days or a week to go and get that care, to get that extra information that will close the loop on the clinical picture and help you care for them in the best way. That's what I love about it.
My name is Nona Smith. I'm a certified nurse midwife and registered diagnostic medical sonographer. My one point that I want the participants to take away from the hands-on scanning event is that remember, you just need to practice, practice, practice. It looks overwhelming right now. Some days will be easier than others, but with practice, you can become an expert as well.